Hello and welcome to Fast Track IELTS. My name is Jordan and I'm one of the OET teachers for doctors, nurses and pharmacists. And this video is going to be an introduction to the OET exam. So if this is your first time hearing about or studying for OET, this is the video for you. So let's get started. So first of all, what is the OET test? And there's a nice quote here from the OET website that I think says it perfectly. OET is the English language test for healthcare professionals, meaning it's an English test that is specific to your profession. Whether you're a doctor, whether you're a nurse, a pharmacist, a vet, OET is an English test for you, for a healthcare profession. So, generally speaking, here at Fast Track IELTS, we're based in the UK, so we are going to be talking about this from a UK view. It is also accepted in other countries such as Australia and the US, but generally speaking, many of the students that we work with are going to be based in the UK. An OET is accepted by the NMC, who are the Nursing and Midwifery Council for nurses and midwives. It's accepted by the GMC, which is General Medical Council for doctors, and it is also accepted by the GPHC, which is the General Pharmaceutical Council for pharmacists. And that last one, the GPHC, was only accepted as of this year. However, OET is accepted for all three of these health bodies that you can see, and it is also the recommended test. There is also the IELTS exam, and in another one of our videos, which will include a link to, you can find out why OET is the recommended test for your registration with the NMC, GMC or GPHC. Great. So it's important to know when it comes to OET, there are 4 sections to the exam. There is the listening, the reading, the writing and the speaking part. And in this video, I'm going to briefly go through each of these 4 sections. Once again, this isn't designed to be intensive study, it's just to give you an idea of what to expect, what these exams look like, and kind of how you can go about taking the next step and to start preparing for the exam. So it's a bit of an introduction. So the first test that you will do when you go to sit the OET exam will be the listening test. And this lasts for about 45 or 50 minutes. And the listening test will basically involve you going into a test centre, listening to a recording, and then you'll answer some questions based on the recording that you've just heard. And the test is broken up into 3 parts, which we can see here. Part A, Part B, and Part C. So in that first part of the test, Part A, is what they call the consultation extract. And in this part, you're going to hear a conversation between a healthcare professional and a patient. And what you'll have to do is listen to that recording and then answer some questions based on whatever it is that they're talking about. So for example, maybe a man comes into the doctor's office, is complaining of a sore leg, let's say. You're going to listen to that conversation they have. How long has it been a problem? When did his leg start hurting? Does it hurt more when he's running? All different types of questions. You'll be listening for that information and then answering some questions based on that recording. Part B then is what they call the workplace extract. And in this part, you're going to hear a conversation between 2 colleagues in the hospital or in a clinic. And that could be 2 nurses, it could be a doctor and a nurse and a receptionist. It's going to be 2 healthcare professionals in a healthcare environment talking about something healthcare related. And again, we're going to listen to those recordings, each one about a minute long, and then answer some questions based on what it is that you've just heard. And then finally, we've got what we call the presentation extract. And in this part, you're going to hear kind of a lecture or a speech or an academic presentation where you're going to hear a professional or a professor talking about something to do with healthcare. Maybe he's talking about myocardial infarctions, maybe he's talking about patient care, whatever it might be. That professional is going to be discussing something, and again, you're going to answer questions based on whatever it is that they're talking about. And generally with this listening test, it gets a little bit more difficult as it goes on. So that first part where it's just a patient and a healthcare professional talking, not too difficult. But then as it goes on a little bit, it can get a little bit more tricky. So something to think about there. Let's move on to the next part then. So the next part is going to be the reading exam. This one, similar to the listening part, it has 3 sections. And again, this one, 60 minutes long. And for both the listening and the reading, we'll need to achieve a score of 30 out of 42 to pass the test. So in part A of the reading task, you're going to read some healthcare related texts. And they could be about all different topics, but usually they'll be quite related to each other. And in truth, the topics that you're going to read about, the questions you're going to read, they're not actually too difficult here in part A of the test. The big difficulty, however, is that there are 20 questions to answer and we only have 15 minutes to answer them. Now, my mathematics is terrible, but I think that works out about 50 seconds per question. So we do need to be fast in this part of the exam. It's about quickly finding the information we need and then quickly getting those answers written down. And it does take a little bit of practice to get used to that speed of the recording. Part B and Part C are what they call the careful reading tasks. This is where we can take our time a little bit more, 45 minutes. But the big difficulty here, is that in this part of the test, we'll be expected to have a bit more of a closer read, a bit more of a careful read. They're going to use more complicated vocabulary, and they're also going to put in a couple of trick questions in this part. Many of the students that we work with as part of our courses find that Part C of the reading exam is usually the most difficult part of the test. Again, something for you to think about, but generally speaking, the reading can be one of those challenging areas of the exam. And this is one area in particular where it's very important to learn the correct methodology and the correct techniques for each of these parts, A, B, and C. Great. Let's move on to the next one now. So the next is the writing exam, and in truth, this is one that everybody finds a little bit tricky and is usually a little bit anxious about before starting their OET preparation. If you've taken the IELTS test previously, you're probably a little bit traumatized by the IELTS writing exam. OET is a bit better, however, so there's definitely some good news here. In this OET writing exam, what we have to do is to write a letter. Most of the time it's a referral letter. And if you've worked in healthcare, you've probably come across these types of letters previously. And what's going to happen is they're going to basically give you 2 bits of information. The first will be some case notes about a patient that you've been caring for. That might include their name, their date of birth, their medical history, any medication they're on, anything related to their health, to their family life, to what's going on with them. And then on another sheet, you'll be given an instruction. And this instruction will tell you to write a letter. Usually that's to another nurse, to another doctor, and it's to explain what's happened to your patient. And your job here will be to read through that information and then write a nicely written, nicely structured letter with good grammar that it explains what has happened to your patient. And when it comes to preparing for this part of the test, it's very important to, yes, improve your grammar, but also to learn the correct structure. And the OET examiners have a very set structure that they like to see. As part of our courses, again, we go over this in a lot of detail, learning paragraph 1, we want to include this information. Paragraph 2, we want to use this information. Paragraph 3. And learning that structure is a very important part of taking this writing exam and kind of getting that passing grade. So next we have the speaking exam. And I always say this is a little bit like an interview. What we have to do in this speaking test, it'll last for around 20 minutes. We'll have to have a conversation with an examiner where they play the part of a patient and you play the part of a healthcare professional. So if you're a doctor, a nurse, a pharmacist, you'll play a doctor, nurse or pharmacist essentially. And what you'll have to do is give them some medical advice, some medical instructions based on a situation that you've been given. Before the conversation starts, you'll be given a card, and the card will explain who your patient is, again, like in the writing exam, any past medical history, and any kind of clues about what they're going to ask you. And your job here is to simply hold a conversation with them, answer their questions, be professional, and kind of guide them through. And if you're giving them information about medication they're to take, you're to explain what the medication is, what it does, any side effects, and answer any questions. And it's important to know this isn't a knowledge test, so they're not interested in your knowledge of medications. All of that information will be provided for you. They're more interested in, can you hold a conversation with this patient? Can you understand what it is they're asking? And can you respond accordingly to any questions that they might have? Great. So before we move on then, you should know that when you go to do the OET exam, you'll be given a grade between A to E for each of these 4 areas. And generally speaking, for NMC, GMC, GPHC registration, you will need to achieve a grade B in each of those 4 sections that we've just talked about. The one exception is if you're a nurse and you're going for NMC registration, they will accept a C+ grade in the writing part. But for everybody else and for those other 3 sections for nurses, it will be a B grade you'll need to take. So when you actually go to do the test, you'll do all 4 tests, reading, writing, listening, and speaking, on the same day, and you need to pass the test in 1 sitting. If you unfortunately fail the test, you will unfortunately have to resit all 4 of those areas. Perfect. So I hope you found this video useful in introducing the OET exam to you. If you have any questions, please feel free to leave a comment below and our teachers will be happy to get back to you to answer any questions that you might have. Or if you'd like to find out a bit more about our Fast Track OET preparation courses, you can go to passmyielts.com. And we also offer a free assessment with our teachers. This is where we'll have a chat with you, explain how the test works, answer any questions that you have, and also explain about how our OET preparation course can help you to pass. So once again, thank you very much for watching this video, and we hope to speak with you very soon. Thank you.